wanted to mention your key support people, I think, is something that's useful to think ahead of time. So thinking about who are your family, who are your friends, what professional support is around, and particularly, as a social worker, I'm often working with the people that are living alone, whose support teams locally are really limited. And increasingly we have people where families are spread. So they might have children who really care a lot about mum or dad, but they're overseas, or they're in Auckland, or they're already caring for another relative in another part of the country, or have childcare commitments, or all of the other things that we juggle in our lives. And so it's just useful to think about this ahead of time. And particularly I see for couples that have been together for a really long time, that's often the key support network, providing support and being a team with each other. And then once one of those people has died, then the support available for the remaining partner is less, which is really hard. So I work with lots of people who have lovingly cared for their partner through end of life. And then when they are unwell and nearing end of life themselves, they don't have that 24-hour person that lives at home that can make a whole lot of things about being at home more possible. Yeah. So just thinking about timing and age and stage and where the family's up to is, I think, a useful thing. And talking as families ahead of time. If kids are somewhere else, can they get here? What would that look like? How long could they come for? What are people prepared to do? Often families haven't had these conversations, and then it's quite a tense conversation to try and work out when time is getting short. Some people have heaps of family, which is awesome, and I see people like that. When I think of rostering for our nurses, a 24-hour shift is 3 different nurses. And then at home, it's often one person doing that day after day after day after day. So where I see it working best at home is where there are a lot of people that are able to support their loved one, and where people can roster and have shifts. And there might be somebody that wants to be there all the time, but even for them to be able to sit out in the sun and have a cup of tea while somebody else is on dinner and somebody else is doing the washing makes home care much more possible. And sometimes I hear people definitely saying to us when they come into hospice, going, oh, I get to be his wife again. Or I just get to have some time with mum because our nurses and our healthcare assistants are doing all of the practical stuff. Yeah. And it's really hard because you never know how long any of these timeframes are going to be. So sometimes families I see are really good at responding quickly in a moment of crisis and people all gather around, but sometimes this is months. And it's hard to sustain that over time. So thinking about professionally who's available and knowing that can be helpful as well. And thinking about friends, thinking about neighbours, and being prepared to ask for help and accept help. Because often people say, if there's anything you need, if anybody says to you, if there's anything you need, try to think about what might actually be helpful, because it's actually brain work for people to even think, what do I need? And it's one of the things that we provide at hospice with wonderful volunteers for hospice patients is we have volunteers that go and sit with people to enable that to happen, because we know that that's a real need, but there's very limited public funding for being able to have paid people do that. So yeah, friends and family being able to say, hey, we'll come and play checkers, or whatever the thing is, so that it's actually quality time for the unwell person too, or I'll just sit with them. You go out, go for a walk on the beach, go have a sleep, go get the groceries, go get your hair cut, all of those things can make a huge difference. If care is ongoing for a longer period of time, being able to have your loved one go and have a respite stay in a local rest home facility is really valuable. There's not very many that are providing the respite care at the moment, so sometimes that means going out of Whangārei, so people might have to go up to Switzer Home in Kaitaia or over to Dargaville to Norfolk Court, which can then reduce people that are prepared to have their loved one go that far away. Another local provider is Aroha House, which provides respite care. It's a private company over in Tikipunga, but that's about, I think, $270 a night before GST, and I'll talk about carer support a little bit later, which is one way that you can also pay for respite. So those are just a few other services to know about. So one is medical alarms that you asked about before and whether they are publicly funded. If you go onto the Work and Income website, they have a list of approved medical alarm providers, so places like St John, Freedom Alarms, there's a few others. And so the disability allowance can be used to pay. They're about $20 a week to have a medical alarm. And a disability allowance, for people that don't know, if you have ongoing regular health costs, you can get a disability allowance which is up to $72 a week. Often being unwell is really expensive, but it's different costs each week, and so that's hard to then prove to then be able to get a disability allowance. And medical alarms are really straightforward. So as long as you haven't used up your full $72 disability allowance, I have met very few people that have, then the disability allowance will pay for the medical alarm. They're really valuable to have. It gives families peace of mind. You can get them now. People might be familiar with units where you are in your house and you can't go further than your letterbox. There are some now that work on mobile coverage. Not as helpful for us in Northland as it might be for other parts of the country, but it means you can wear it in anywhere that you have a cell phone coverage. You can push your button and it will get through to the ambulance. Sometimes it's the difference between what makes it possible for people to stay at home, and it also takes a bit of time to organise. So I recently had a situation where I had somebody that was really unsafe in the community, didn't have family or friends that could be with her overnight. I was getting her into a rest home the next day, and she was just unsafe overnight I was like, could we even get a medical alarm? And that was going to be a 2-week wait. So again, thinking about these things ahead of time and getting them in place means that you don't get into the really dire situations. Meals, the two main places that I would recommend locally is, I don't know how you say it, some people say it's Sabres, some people say Sabreeze. It's on, how do you say it?
Sabre.
It is? I need to go and visit them. And yeah. So Sabre up on Station Road, they provide freezer-packed meals, and there's no real meal service, particularly for people in that last acute phase of life, end of life, that can do meals. So having a whole stash of them in the freezer can make a real difference. They do a really nice size, which often as people are eating less, having a whole meal can be quite hard going. So they do them, and then also Forget-Me-Not, which is next to Whangarei Falls, they do pre-packaged freezer meals as well. $10 for about that big, and they also do delivery for some parts around town. So that's a really good way if you know people that are at home and can't cook for themselves anymore, being able to rock up, as long as they've got freezer space, with a whole bunch of these can also make home an easier place to be. Total mobility cards. This is a scheme for being able to access taxis at a 75% discount. So if you meet particular criteria, you can get an assessment to get a total mobility card. It's just kind of like a credit card sized thing. And then any of the local taxi companies will give you a 75% discount up to a $60 fare. After the $60 fare, you need to pay the full amount for the rest of it. So if you were going somewhere far enough that it cost $80, you would pay $15 for that 60 plus the 20. So an $80 fare would become $35, if that makes sense. If you're going a short way, you just get the full 75% all the time. It can make a real difference for people needing to get to medical appointments who can't drive anymore. So that includes driving Miss Daisy, and it has the wheelchair hoist for some of them as well. So that's a really good thing to know about. It's through our local council. For hospice patients, you just tell me and I organise it. For other people, you go through needs assessment, North Haven, or aged concern. So linking hands, and then there's also the St John Health shuttles that for health appointments particularly, you can get a free shuttle through St John, or they just ask for koha. Carer support. I always find this one tricky to explain, but through the Ministry of Health, there is a little pot of money that is there to provide respite for people who are caregivers. And so it's acknowledging that we've got people out in our community who are providing full-time wonderful care, and that's hard going and you need a rest sometimes. And so you can get signed up for 28 days, is all I can do. Sometimes you can get 50 over a year of days, and you get $80 per day. So that can be used if I'm caring for my mum and I'm the full-time carer, and then I need to go away for work and my brother stepped in to be the carer for my mum, I could claim $80 and give it to my brother. Sometimes it makes more things available for people in terms of particularly petrol costs, because sometimes there's this many people you could ask to do things for love, and then the circle might be a bit wider that if you can say, I can cover your petrol, then people are prepared to come. But if it costs them $50 to get you home and back, then they're not so likely to take on that personal cost. So carer support, again, you can ask your GP. For hospice patients would ask me. That's through the Ministry of Health, nothing to do with work and income.